Hello there, pharmacy technician students. Let's continue on our journey. We're going to cover the prescription process. So in this first part, we'll talk about the procedures, what to expect, and the order you want to operate. If it's your first time with us, well, welcome to the community. And if you've been here before, welcome back. Without further ado, let's continue on. All right, today's learning objective, we'll understand the prescription process from the generation of the prescription all the way through patient pickup and patient counseling. And then we'll cover the other learning objective in the subsequent parts. So this is going to be a three-parter. So this is one of three. The prescription. So it can come written or nowadays electronic with physician computerized order entry. So who can write prescriptions? So we got medical doctors, optometrists, those look like dentists, veterinary medicine, nurse practitioners, yes, they can write prescriptions, physician's assistant, some pharmacists with the appropriate training, and many others are able to write prescriptions. Psychiatrists, well, they're actually MDs with additional training, so they can write prescriptions. Always under state and federal regulation, who can and cannot write. Make sure you follow the legislation, regulation in your area. In the community pharmacy, we dispense directly to the patient. So from there, it's no longer under our control. And in many ways, that's where drug therapy is most dangerous, once it's out of the healthcare workers' hands. In the hospital, however, the pharmacy will dispense to the nurses, and then the nurse will administer the medication to the patient that are in the inpatient settings. The prescription process. So just run through your head what needs to happen first, what needs to happen next. So there's certain prerequisites, and they'll help you kind of identify the steps. So the first step, it has to be written and or created, entered into the computer by the physician. Once it's written, it's got to make its way to the pharmacy somehow, whether a hard copy handed in, fax, email, scanned, and nowadays electronic data interface with e-scripts. Once you receive the prescription, you got to check, make sure all the information is there, make sure it is legitimate. It doesn't seem fraudulent, no weird marks, and anything that might bring up a red flag. Next, check the patient and prescription information and enter it into the computer. And next, you'll enter in the insurance and billing information to make sure that you'll get paid for the prescription. So we may collect just the copay at this time, and then bill the insurance company for the remaining balance. Once the claim is adjudicated, a label will be generated. And when the label starts printing, that's how you know that you're going to get paid for it. So go ahead and start prepping the prescription. So you'll prepare the prescription, look at the label 3 times, double check everything against the hard copy. Then you'll leave it out for the pharmacist to check. We'll take a look at how they'll do that in the retail chapter. The patient comes and picks up the checked prescription. And the last thing we need to do is for the pharmacist to counsel the patient. So everyone in the pharmacy must offer the counseling. If the patient refuses it, just document it. But only the pharmacist can conduct counseling. So remember to distinguish the difference in the medical profession. As a medical assistant, you may need to do the patient education on their medication. Pharmacy abbreviations. So the doctor will use shorthand codes, and as you've seen in some of our assignments, they don't always give you all 6 elements. Be familiar with different routes, dosage form. So I mentioned tablets are not all the same. You can have extended release tablets, sustained release tablets, controlled release, immediate release. So make sure you dispense the specified release form. Frequency, amount, and of course any information. So review your SIG codes, 1, 2, and 3 presentation, and your homeworks from last week. Let's go through the different parts of the prescription. So first you have the prescriber's information. So they are the provider in this case, so they require an MPI number as well. DEA numbers. We covered DEA numbers in Chapter 3. You'll need to verify DEA numbers if the prescription is for any controlled substances. National Provider Identifier. Anybody that deals with PHI, Protected Health Information, requires an MPI number. So it's a 10-digit number. So anyone dealing with PHI, pharmacy, insurance company, in this case the doctor. Dates written. So we'll go through, or we went through in Chapter 3 when prescription expires and how many refills you can have for each controlled substance. We got the inscription. Remember, that is drug information, name, dosage form, amount, strength, things like that. Signa is the directions. So this part right here is the signa. It's not part of the inscription per se, because the inscription is just drug info. The whole thing is the prescription. We have inscription and also the subscription. Subscription is just information for the pharmacy staff. Prescriber's signature. Dispense as written if needed, and there's many ways or many reasons why you would have a dispense as written code. The doctor can specify a particular brand. The patient can want a particular brand, or if you don't have the generic available, you may have to substitute with the brand, but bill them for the generic price. Refills, maximum according to the controlled substance schedule. In this case, Actos is not scheduled, so the prescription is usually good for 1 year. So you get your initial dose, and for this example, 11 more to round out the year. Patient info. Review question. What does MPI stand for? So anybody dealing with protected health information under HIPAA will need an MPI number, which is a National Provider Identifier or identification number. How many digits? You guys remember how many digits in an MPI? If you said 10, you'd be correct. Which of the following cannot prescribe? So who cannot write a prescription? Licensed vocational nurse, family nurse practitioner, doctor of osteopathy, or doctor of dental surgery, I believe, or none of the above. All of them can write prescriptions. That's going to be the LVN or the LPN, licensed practitioner nurse or practical nurse. They're below the RN. So RNs can't really write prescriptions. It's usually the nurse practitioners, a level up. So these guys are a level below or a couple levels below a registered nurse. Who is required to use an MPI number? So I think I gave that away last slide. That's going to be anybody who deals with protected health information. So prescribers, pharmacies, health plans, and those are the insurance companies. Which is not part of the inscription. So we have prescription, the whole thing. Subscription, information just for the pharmacy staff. And then the inscription is drug info only. So directions are sig codes, directional codes. The prescription process. So place the following in the correct order. So if you get a question like this, I may not give you all the steps, but just place them in order. So the first thing that needs to happen is the prescription needs to be written. So just talk through what would the next step be. So the next step is, well, that prescription needs to get to the pharmacy. So here, that's not on there, so we'll go to the next step. So once it gets to the pharmacy, you'll need to check the prescription. So check the prescription to see if it's all there. And that step's not on here. So once you feel that prescription is legit, then you're going to start entering the patient and prescription information. Once you enter the patient and prescription information, you got to make sure that you're going to get paid for it. So you'll need to add in the insurance and billing information. Unless they are a cash payer, then you would omit this part. You would just skip this part. Once the claim's adjudicated, there's going to be a signal for you to start prepping the medication. And that signal is the printer going crazy. So when the label is generated, that's your cue that we're going to get paid for this prescription, and you should probably start filling it. So we'll prepare the prescriptions, and once the prescription is prepared, we'll leave it out for the pharmacist to check. Even if it's a refill, the pharmacist will still need to check. Then we package it away, the patient picks up the med, and the last thing we need to do is offer counseling and conduct the counseling. And that's only the pharmacist in the pharmacy setting that can conduct the counseling. So not too bad. Just run through the steps in your head. And if the next step is not there, just go on to the following one. Right? All right, that brings us to the end of part 1. So coming up next is part 2 of 3. And we're going to get into more of the prescription process. Safety. Thank you for joining us today, and we'll see you again next time. Have a good day.